Good evening. This is Roberto Santamaría, the Director of the Health Department for Nantucket. With me today is Gary Shaw, Dr. Diane Pearl, and Jason Graziadei from the Nantucket Cottage Hospital. Gary Shaw is our CEO and President of NCH. Dr. Pearl is the Chief Medical Officer, and Jason Graziadei is the Public Information Officer. And we're here today to answer all the questions that you may have for us regarding COVID-19 and the ensuing pandemic from the last 8 months, in case people haven't noticed. So we're here for you to answer any questions you may have. Real brief, real quickly, if you want to ask any questions, please zoom in using the link underneath the screen on the YouTube link on the YouTube channel, and you may ask us any questions through Zoom. You may also type in questions in the chat box if you are zoomed in as well, if you don't want your voice to be heard on TV. So I would like to just quickly jump right in. If my three panelists also like to introduce themselves. Gary, take it away.
Sure, it's my pleasure, Roberto. And hello, Nantucket. Thank you for the opportunity tonight. If you go back to sometime in March, I know Roberto and I were in a room wondering what was coming, and we used the analogy of the outer bands of a hurricane. And we were wondering when the wind would start and which way the eye of the storm would shift. And we've done some great things as a community navigating all of the paths of a moving storm, even with the recent cluster that I know you're all aware of that seems to be subsiding and it's working well. And it's a good time to look outside your window right now with the hurricane that's passing by us. And although we started to see some clouds and the wind increased today, we're now seeing the sunshine come out as the bands move farther away. And I think that's where we sit with the environment on Nantucket as an analogy. That's not to say it's gone and that it can't come back, but to work towards vigilance and do the same things that you've been doing to help us mitigate this current cluster outbreak, washing your hands, social distancing, wearing masks. All those things have made such a difference in this community. And I want to thank Nantucket for leaning into it to help us come through this, to help those people that were ill and to help us stay safe and have an economy on the island. Now I have Dr. Pearl, who's on the other end of the Hollywood squares here. And she's been my right hand and a mentor to me in many ways as we work together to answer the questions of the community. So Dr. Diane Pearl, I'm sure you have some words.
Thanks very much, Gary. Yes, looking back from this point, I can only be just grateful that our community has done as well as it has done, that we have fared just so well, and we've been so fortunate. So we have had a few bumps in the road, you and I, the hospital. We really tried to stay ahead of this curve from the beginning, and I have to give you the credit for being a well-organized leader and a leader with foresight and to focus on preparation. So we have been prepared, and we've tried to prepare from the beginning for large numbers of very sick people, which fortunately we did not see, and prepared for large volumes of summer visitors, which we did see, interestingly enough, and for the scattering of disease that they brought with some of them from other places. But we, and then we remained quite quiet here on Nantucket until recently. And I think we've just had a little learning moment on Nantucket that we have to remain vigilant. And so we've seen a cluster, we've seen spread from person to person on the island who were working closely together or living closely or exposing each other. And gratefully, again, the people were not terribly sick. Everybody has done well. And we've just learned, and we've learned to have more experience with what to do to stay healthy and more regard for this disease and how quickly it spreads and how easily it spreads if we let our guard down. So I hope too that we won't see any more of that. But we're going to stay vigilant and we're going to stay prepared.
Jason, would you like to say anything?
Yeah, no, hi everyone. I just want to say a thank you to everyone, who's helped the hospital. There's been so many people who have stepped up for us, and from my perspective, in terms of communication with the community, I think we've done more, communication over the last 6 months than maybe, my first 6 years here at the hospital. But it's been really rewarding. The feedback's been great, and I want to thank. There's been a group of volunteers in the community who have helped with translating messages and making sure that everything that we put out has gotten to every segment of our community, whether it's Spanish speaking, Portuguese, Bulgarian. So that has also been, I think, a really gratifying part of this experience is, just helping get the message out to everyone, and that we're all part of this, as Gary said, all in it together. So I think from my perspective is doing the communications for our incident command at NCH. That's been really helpful from the community volunteer standpoint, and rewarding to see that the message does get out when we have important news to share.
Well, with that, we'll move into our question and answer session. Anyone who is interested in asking a question, if you're logged into Zoom, you can go ahead and click the raise hand button next to your name. Otherwise, if we can put the YouTube questions up, the chat, if that's available. Okay, so the first question that we have that has came in is, where do we have to go take the test and see if we've had COVID, and how accurate is it? So I believe that would be a good question for the hospital.
The test to see if a person has had COVID is a blood test, and it tests for antibodies for that virus. And I think that it's thought to be quite highly accurate if you've had this disease in the last several months. We don't know how long the antibodies stay in the system, but certainly at this point, most people are within the 6 months of having had an acute infection. It does require a doctor's prescription. It is sometimes covered by insurance. I'm not sure if it always is. And it serves no particular benefit at this moment in this society because we all are still masking and protecting each other. So that knowledge is it's something people want to know, and they certainly would feel happy if they've already had the disease. But as far as living in this country at this moment, it doesn't add any benefit particularly.
Thank you, Dr. Pearl. Mm-hmm. We also have a question coming in from the audience that says that should we plan for next year to be the same as this year as far as regulations about gatherings, or is it too soon to tell? Well, I'd love to say that's a hospital question, but unfortunately it's a question for me. So what we're looking at right now is we have to think of COVID as a long-term illness. We do not expect the vaccine for COVID to be available for a significant amount of time. From the very beginning, we're hearing comments about 12 to 18 months at the minimum before a vaccine is even available. That's even, and in my opinion, I believe that's just talking about approval. Available is a completely different conversation. Available means that not after the vaccine gets approved, they now have to ramp up the production of it and the distribution, which can even take at least another year. So, we're looking at 24, 30 months or so of this from when this whole thing started. So I would say that unfortunately, yes, we should look into maintaining vigilance, looking at masks. Gathering orders might be a little bit more relaxed this coming year, but I wouldn't expect it to be, a free-for-all. I wouldn't expect it to be like it was last year. COVID has changed the face of the earth and society and how we approach everything forever. This is the pandemic of our careers. And just as the AIDS epidemic and pandemic changed policy for medicine and public health forever, COVID has changed policy in medicine forever as well. So we need to look into and expect the possibility that we will still be in a highly regulated situation. Now, if you have any opinions on that, anyone at the hospital as well, I'd be happy to get any opinions from you as well.
Well, I think you're right, Roberto. It's going to be a journey as we see different studies emerge and vaccines emerge that show, how we can prevent this disease, work differently. We learn more about it every day. I would say we won't be seeing anything that's available on mass production to get out to the United States for probably more than a year to two, because it takes so long to produce, come up to speed, and then get it to those in need. So it will be an interesting time in our society to look at, how we can tackle this head on with what might be have a good efficacy. And there's probably 3 to 5 different vaccines now that are being studied around the country. So it would be nice to see all available if they actually can work, but time will tell.
Absolutely. Thank you, guys. We have another question that just came in. We know we can expect additional clusters as time goes on. Many people feel that the school district overreacted by switching to full remote learning based on this last cluster. How can we build confidence in our testing and contact tracing to avoid overreacting to future clusters as they are likely to occur? We know that the population denominator being used by the state is a complete misrepresentation of our current population, and thus our heat map is not aligned with the rest of the Commonwealth. So that's a very great question. That's a very good question. So one of the things we're running into is that the original guidance that we had received from the Department of Elementary and Secondary Education, you'll hear us refer to it as DESE, the original guidance that was out there, and is the guidance that we were forced to act upon, is that as soon as a designation is turned red, the schools have to go remote. Since then, since what happened on Nantucket and what happened in Chatham, which is exactly the same thing, Chatham had a small spike in cases and they ended up red, even though their population is also not represented correctly due to what they know as their year-round. Since then, DESE has released more guidance. Now, though, what they're saying is you need to take 3 weeks into consideration. If a community is still red after 3 weeks, then close the schools at that point, then go to remote, which the original guidance said, the moment it goes red, go remote. So there is actually a school committee meeting this Thursday that I will be a part of, and we will be discussing reopening the schools in the hybrid form, especially as we're seeing the cases starting to level out and drop. So that is good news, and there is new policies in place to prevent, as you said, an overreaction. It was not necessarily an overreaction by the school committee, and it was not an overreaction by the school administration. It was following the rules that were set to us, and we were forced to abide by them. And since then, those rules have changed, because the state did realize that even though you will be a municipality will end up in red, it is also overestimating the risk in a town. So thank you for that question. It is an excellent question. So it doesn't seem like we are getting a lot of questions coming in. So real quick, Gary, if you would like, Gary or Dr. Pearl or Jason, if you'd be happy to answer any of these questions from what I've heard, is how is the hospital preparing for any possible secondary surge, especially as the population moves indoors in this coming winter?
Well, I certainly think, Roberto, that we learned a lot from this recent small surge that we had. And we learned that we could really uptick the number of tests that we can perform quite well. And during those few days following the start of this cluster, our testing site was almost incapacitated by volume, but not. And we were pretty careful to be flexible and allowing ourselves and somehow providing testing for that number of people, which we never actually would anticipate would flood the gates, so to speak. But because we're going to remain very flexible and continue on making contingency plans just for that event, I think that we'll be okay and be able to provide for the community in the event of another cluster. It is really challenging, though, for the staff at the Portico going through test site because people are really emotionally upset and concerned and afraid and have a lot of misinformation. And so it has been a challenge for them to continue to provide calm, constant and reinforcement of the facts as we know them and who's at risk and who isn't at risk, and provide appropriate testing to the largest number of people we can. And so we were really, really pleased with how they functioned during that for the most part. And we'll continue to consider how to improve it if we have another such demand as we had.
And if you don't mind me asking, if there's been a couple questions about the landing pad of the helicopter. Some of the pickups are happening at the airport right now. Is there a time frame about when the helicopter is going to be able to land at the hospital again?
Yeah, thanks, Roberto. I'll answer that. Well, we wanted to redesign the pad because it had too much of a roll curve on it that wasn't matching the ability for helicopters that landed to get the gurneys to load appropriately. And when we went back and checked the specifications for building, we found that that the pad had too much of a curve. So we waited until the end of the summer to address this, and it's going to be about 8 weeks now since the pad has been torn up, rebuilt, relighted. But it takes about 8 weeks for the cement to cure. So as soon as we get the green light that it's cured, then we'll paint it, and then we'll have the helicopters come back. It is something that we did when we were building the Cottage Hospital. It doesn't create any major delay in getting care, but it is certainly more appeasing to be able to go right in and out of the emergency room. So about eight weeks.
It's really important for everyone to know as well that even though the pad is being worked on, we can still get patients off island as well. Very important. Thank you, both of you, for answering those questions. As we wait for any more questions to come in, any updates from the hospital as we're moving into the fall? Anything that you would like to, any information that you'd like to get out there?
Well, I would like to give a few totals thus far. We have tested coming up on 9,000 COVID tests, which is an enormous number for a community of our size. And to date, we have 105 positive tests. Our last positive test was on the 17th of September, Roberto. So we have had some really great news in the last few days. We've also opened up our drive-through flu vaccine clinic, and that we have provided 2,600 flu vaccines in the past week or so since we've been open. And so the volume has been tremendous through the clinic, the drive-through influenza site. And I think we started, Gary, to think about having 6,000. We probably are going to be upwards now of closer to 10,000 in my estimate, but we'll just keep going. We'll roll as long as we can, and we'll make some provisions for winter and darkness and coldness and see how we can continue to do this.
Yeah, I would add that our goal is to provide influenza to everyone that would want to get it on the island. The more the merrier. We'll keep supporting the need. But let's not stop with influenza. There's been lots of vaccines that have been developed over the years for similar types of scourges. And so you look at shingles and pneumovax and all of the different vaccines for children to help them grow healthy. There's been a lot of hype out in the media about whether they're safe or not, and I will tell you they're safe. We have our clinicians that will be happy to talk with you about their efficacy and their safety, but they certainly save lives. That's why they were developed. So I know Jason, if he hasn't already, was intending to publish a schedule on all immunizations, not just flu, that are available here at the Cottage Hospital and when. Jason, did that go out or do we have that coming out soon?
Yeah, it's going to be up on we have schedules posted on our website in a PDF. We're trying to make it more sort of graphically pleasing. So we're working on that so it'll be easier to read for folks, but we do have those schedules up on our website now on the page on the NCH website about vaccinations and for all ages.
But the most important currently with COVID and the symptoms that it has, very similar to influenza too, come and get the vaccine. You certainly don't want those two diseases at the same time, and do everything you can to prevent it and stay healthy. So thanks for coming in. And it's fun actually to look out the window and see the lines of people coming here. And again, what were the hours that were open for the flu vaccine, Jason?
Yeah, so right now for the next 2 weeks, we are open Monday through Friday from 7 a.m. to 6 p.m. and on Saturdays from 8 a.m. to noon and closed on Sundays. So our goal was to really have some early morning hours, keep it open through lunchtime if you want to come on your lunch break, and then also provide some evening hours to make it really convenient for folks also on the weekends. So, the response, as Dr. Pearl outlined, has been really incredible. And we just want to keep going because we want to do as much as we can, given everything that's going on with COVID and trying to keep the flu cases down. So hours are there, and we're going to work to keep those. They're subject to change because our staffing is obviously, when we've got the COVID going and the flu clinic going, it's definitely a stretch. But we're going to work, and any change in the hours we'll share on our website and social media and get the word out. And I'm sure we're going to get we've gotten the question for the first 8 days is, yes, we do have the high dose flu vaccine for folks over 65. We did run out briefly, but we're resupplied, and we should be fine as long as the boats start running again pretty soon. So,
yeah. So we moved into COVID and we had to eliminate some voluntary surgeries, elective surgeries and clinic. We replaced those over time with virtual visits. And that's a very effective way to stay home if that's where you'd like to be, by signing up for the partner's healthcare system and signing up for the patient gateway, and then being able to make appointments where you can be seen virtually from home. I was talking with Dr. Pearl today about how efficient they are. They actually, according to her, make a physician's life more pleasant with the interaction and the way the appointment works, just in that it's a comfortable environment for you. It's a comfortable environment for us. And we would like to do as many of those as you would allow. So choose that as an option when you're looking for an appointment, if the clinic is a place that you'd want to not come. Mm-hmm. But our healthcare and our environment is safe. You're welcome either place. We would just welcome for you to use those options at your leisure.
Mm-hmm. And in the ensuing time, we did get a couple questions. One of them is, as we head into the winter months with these crises still in force, are there any recommendations from you how to maintain mental health, or any mental health programs that we may have? So as far as we know, we do. As far as services go, if anyone is in any issue with mental health crises, as needed, please. There are people there. We do have people here. If you're in an immediate crisis, please dial 911 and discuss that and connect with our dispatch office. Fairwinds is available. A Safe Place does have counseling as well. There are various counselors around the island. I believe that there is some mental health crisis work available at the hospital as well, needed.
Yes, that's true, Roberto, absolutely. And certainly our same-day clinic can help people find a practitioner, a therapist, whoever they need in a crisis, or even if there's some time to find someone who fits perfectly their needs. I think that we have a list of a number of private therapists in the community. The Osno Clinic also does some counseling of their own for certain types of problems. But it is a very valid concern across the country and the world of how do we stay positive when we have one crisis after another facing us. And I think it's going to be in finding friends and family and positive activities, which there are many that we can still do, between cooking and walking and reading and not listening to really difficult news day after day after day, because it's quite depressing. So we don't want to do that. We want to be having as much fun in life as we can and enjoy it.
Those are all great suggestions. What do you guys do to keep your mental health up? Actually, these were great. I participate in our jiu-jitsu team here on the island, and I also I'm a movie fan, so we do watch a good amount of movies as well. What hobbies keep you guys up and running in the winter?
I have two black Newfoundlands, and two cats and two parrots that love to talk, and just spending time with the pets, going for walks, hitting the beach with them, enjoying some friends over and some cooking, and focusing on what I have, influence over as a positive way of moving my life forward. That's where I look. I don't watch the hype. There's too much of it out there, and I look towards positive relationships. And it starts with my wife and my pets, and I go from there to my children and the rest of the country.
Oh my goodness.
Yeah, I like to get outdoors, go out for a run. Sometimes I bump into Dr. Pearl out by Almanac Pond. But one thing I did want to mention is a project on this point, Roberto, is a project that our social services manager, Sarah Munson, is going to be spearheading, and we're going to be launching this within the next couple of days on our website. And what she's calling it is the COVID Grief Project. And it's really about sharing some of our collective experiences over the last 6 months. And we know that everyone has experienced some loss during this pandemic, and some of it could be very acute, like losing a loved one, and some of it is things that's just very simple things, whether it's not being able to see your grandchildren, missing a job opportunity, or the first day of school pictures, things like that, where you might feel a little, like that's not necessarily grief like you usually think about it, but we're all sort of a way to acknowledge the loss and the shared experience that we have. So we're going to be putting this up on our website and an email address for people to share some of the things, their experiences, some of their stories, and just as a way to share that with each other and acknowledging it. So that, I think it's kind of a nice project that Sarah's spearheaded with Taylor Hills from the town as well. So we're going to be rolling that out and encourage people to participate.
Yeah.
Dr. Pearl, any parting wisdom before we start signing off?
Well, I was going to respond as well that there are many things in the community that are available by Zoom now, with exercise classes and book groups, and things that you did beforehand now can be done using the Zoom technology. You get to see each other's faces, you can see emotion, you don't have to look at a mask. A really great way to reconnect with people. So reconnecting is really good. And I'm just happy to be in this community, that's for sure. And we're really grateful for how well we have been in this community.
So we're running out of time here, so there's no more questions. So we want to thank everyone for watching. Jason Graziadei, Gary Shaw, and Dr. Diane Pearl from Nantucket Cottage Hospital. I really appreciate you joining us today. And I'm Roberto Santamaría, your health director. And if you have any questions, please feel free to reach out to us. Our direct email through the health department is health@nantucket-ma.gov, and feel free to check the nantucketcottagehospital.org for daily updates on COVID.
And Roberto, is this where you end it with a joke? Or is that Gary's job? I can't remember.
I think, Gary, why don't you end us with a joke?
No, I don't have a joke. I'm just going to say, good job, Nantucket. Very proud of you, all that you've been through, what you've accomplished, and we're moving into this with great steam. Keep up the great work. We're here with you. Excellent.
No, Nantucket, you've done fantastic, and we really appreciate the work. It's been a team effort, and this is proof is in the pudding that it takes a village. So thank you, and good afternoon and good night.
Thank you, Roberto.